Director of the Pan American Health Organization, Dr. Carissa Etienne, said the organization is intensifying donations and technical assistance to countries in Latin America and the Caribbean as shortages of health workers loom and oxygen supplies run dangerously low.
To fill critical gaps, PAHO donated more than 7,000 pulse oximeters and nearly 2,000 oxygen concentrators to help health workers identify when a patient needs oxygen and to ensure that they have the supplies to help them recover. We are working hand in hand with ministries of health, particularly in hard-hit places like Bolivia, Antigua and Barbuda.
Dr. Etienne said in North America, Canada is seeing higher rates of infections than the United States, particularly across eastern Canada.
Cuba continues to drive most new infections in the Caribbean, although smaller countries like Trinidad and Tobago are experiencing significant jumps. In St. Vincent and the Grenadines, COVID-19 cases in evacuation shelters continues to be a challenge following the frequent volcanic eruptions. Throughout much of the Americas, we are seeing cases accelerate along national borders.
She said nearly 80% of the region's intensive care units are filled with COVID-19 patients. Meanwhile, PAHO has helped deploy 26 emergency medical teams in 23 countries. Dr. Etienne said considering the current spread of the disease, an additional 20,000 doctors and more than 30,000 nurses will be needed to manage the ICU needs of Latin America and the Caribbean.